Hello, my name is Nigiste Abdi. I am a third year MSW student here at UW-Tacoma, and my background is in hospital social work. I am currently working in the emergency department, doing crisis intervention social work, and I hope to continue doing that work after graduation. And my passion include working with marginalized populations and advocating for them in the healthcare setting. So that is what I wish to do after graduation as well.
Hi, my name is Krista Koller. I am also a third year MSW student here at UW-Tacoma. I currently work in community mental health here in Olympia, Washington, and my background includes homeless street outreach and shelter services. So our proposed intervention is the navigation team, and it was born from our shared interest in the relationship between social and health services and enhancing social justice values into everyday patient care. Our motivation to develop this intervention really encourages collaboration between healthcare and social service providers to support the overall health and well-being of the community's most vulnerable members. And it grew from our personal experiences in the field, witnessing the impacts of service provision gaps on patients who need them the most. So in addition to our personal and professional experiences, there's overwhelming data and research that indicates and demonstrates the cycle of patients who are experiencing homelessness and living with co-occurring disorders, their use of the emergency department as their primary care as a way to meet non-emergent and oftentimes non-medical needs. This cycle continues as emergency departments are often ill-equipped to address these chronic medical issues, which are compounded by complex social needs, which lead to crowded facilities and overtaxed staff, and ultimately to inadequate patient discharges. So ultimately, our goal is to develop a community-based intervention that enhances an emergency department's capacity to screen in and support its most vulnerable patients. So by adapting the referral process to really address and incorporate patients' barriers, their limitations, their challenges, the navigation team aims to increase accessibility by increasing that accessibility to existing community resources and agencies. So with acknowledgement to the social, institutional, systematic barriers with healthcare systems that have historically marginalized people experiencing homelessness and living with co-occurring disorders, the navigation team works to rebuild that trust and respect between the patient and provider. So through a trauma-informed lens, patient-centered and peer-driven approach to care, the navigation team aims to reincorporate a patient's social determinants of health into their overall care plan. So as patients transfer from clinical care and back into the community, it's known that it's the most vulnerable point in their recovery process. And for patients experiencing homelessness and co-occurring disorders, this point is even more significant, as a lack of care coordination increases their risk of rapid rehousing or rapid rehospitalization, incarceration, and some symptom relapse. So ultimately, the navigation team will work to enhance and increase continuity of care for patients experiencing homelessness and co-occurring disorders, and decrease their dependency on the emergency department for their non-emergent and non-medical reasons.
Like Krista said, the navigation team is set in the hospital. It's a nonprofit agency that aims to provide supplemental support services to medically cleared emergency department patients experiencing homelessness and other co-occurring disorders. Our objectives include creating a screening that will be implemented within the patient registration process, and questions such as housing status questions and social needs of patients, so that a hospital navigator is able to connect with the patient once they are determined to be either experiencing homelessness or housing insecure. Our other objective includes really enhancing the patient's capacity to address their immediate needs so that they're able to follow up with recommendations that are given to them while in the ED so that they are not returning for similar or the same reasons to the emergency department. And that will be taken care of with the help of our community navigators. So both of our departments, the hospital navigation team and the community navigation team, is going to be made up of folks that have lived experiences and look like the community that we are serving. So that will be people who are diverse in backgrounds, different languages spoken, different citizenship statuses and religions, all creeds of life, and people who have even experienced homelessness in their own personal lives. The hospital navigation team will be the first point of contact where patients will meet with the hospital navigator and do an initial intake and figure out what are their immediate firsthand needs while in the hospital. And with that comes the resource room where patients can go to get tangible help and resources such as clothing and hygiene needs, and it's more of an immediate way of them getting their needs met and getting over those barriers. Once they are set up with the hospital navigator, they will be connected with a community navigator who's going to help them in the community where they are and meet with them for a period of time as long as they need to figure out the way for them to meet their needs outside of the hospital so they are less likely to return for the same reasons. So that our approach is covering both on-site and off-site so that patient is supported holistically. Our program will be evaluated on a constant basis by the patients we provide services to, as well as the hospital navigators and community navigators, our community partners, as well as the hospital staff, so that we are always growing and assessing for needs that need to be met and any gaps that we may be able to help with. Thank you so much.
Thank you.